It's 1957, and you're upset. You're sitting in your doctor's office and he just finished telling you that you have arterial sclerosis and that your arteries are hardening. He's very careful to emphasize that you're at a high risk for a heart attack or stroke. He suggests that you undergo a procedure to evaluate the severity of your condition, or to find out just how close to death you are. It's not complicated, just an X-ray under anesthesia, but you also need to be injected with a chemical to enhance the images that are taken. You can't help but picture being injected with something that's going to make your arteries glow neon yellow. But overcoming your hesitance, you agree to the procedure since your doctor thinks it's important. A week or so later, you wake up in a hospital bed and look around a sparse white room. You take a deep breath, move your head around, stretch your arms overhead. But something's just not right. Can't feel anything from the waist down. You try to wiggle your toes, nothing. You try to wiggle your legs, nothing. You try to wiggle a different appendage, but nothing will move. How did this happen? It was a safe procedure, wasn't it? If your doctor knew you could be paralyzed, he would have mentioned it, right? But he must have known, he's the doctor. So why didn't he warn you? It's not right, and not what you were told could happen. So you take the doctor to court. This is what happened to Martin Salgo, and his case became the first to address how much a patient ought to know about any medical procedure or intervention they were consenting to. At the end of the trial, the judge announced that the doctor had severely failed Mr. Salgo. It was impossible for him to make a good decision when he hadn't been told all the information that was relevant to it. The doctor should have stated the risk of paralysis, especially since Mr. Salgo's decision to go through with the procedure was understandably based on the belief that it didn't have any significant risks attached. According to the judge, the doctor violated Mr. Salgo's rights as a patient and failed at fulfilling his duty as a physician. It's because Mr. Salgo brought this case to court that a new legal precedent was set in clinical medicine. One in which a physician has a duty not to just get consent, but to make sure that it's based on an appropriate level of knowledge and understanding. The judge referred to this new dimension of clinical practice as informed consent, and it was the first time the term was used publicly. To learn more about the history of informed consent, check out the next video. If you like this video, please subscribe to the channel to learn and watch more about what the hell is bioethics.